Hi, I wanted to share an experience that I went through the other day with my younger sister. As some of you know, I became a sibling caregiver to her shortly after my ex-husband had became he got down and I became his caregiver. And my sister experienced a mental breakdown, I think in 2020, 2021 time frame, and her mental health has gotten progressively worse since then. And due to her not being able to work or have any kind of income due to her mental health, she doesn't have insurance, and we've gone through things to try and get her disability and things of that nature. And so it's been really hard not having the finances to get her private insurance. And because she's not my child, she's an adult, and she doesn't have like an intellectual disability to where I would have any type of say so over her. And um guardianship and conservatorship are options, but they're very expensive. And those were not options that I had going through school and divorce and things like that. And so we have been at the mercy of Denton County and Comal County mental health systems, which are not great. And so the other day after work, I had gone to take my sister some clothes. For the last probably month, she's been staying on the streets or in various hotels, and due to her mental health, there are a lot of the hotels that she is now banned from. And so the other day I had gone to take her some clothes, and she was at a store in Denton, a very large, well-known store. And so I had gone in to take her the clothes, and I noticed she had a basket, a shopping cart full of items. So in my mind, I knew she did not have the money to pay for all the items in her cart, but she believed that she did. And so I was just talking to her. I was telling her, hey, I was asking, do you have the money for this? And she said yes. And I was asking her, well, are you going to go check out? I can walk with you, just because I've been concerned about her, especially because she's been unhoused and just wandering around between Denton and Louisville, of something happening to her. And so with being in the store, I didn't know how long she was in there, or if there was a possibility that maybe they had already been watching her. And I just wanted to try and avoid any type of potential issues, making it look like she was shoplifting or anything like that. And I was pretty sure also at that time that she was either experiencing a manic episode or she was in psychosis. And so she said her friend was there. She was waiting for her friend, who was an employee and was on break. I had not known her to know anyone at this store, and after her mental health became worse, she lost all of her friends that she had. And so eventually I was able to confirm if this individual really worked here, if that person was real. They confirmed that they were. And so the worker ended up going to the back because this individual was on break, and went and got them. And I was just following her around. I had reached out to our parents to let them know, a parent of ours to let them know that was going on, because I was concerned about my sister trying to go to the cashier to check out, and she has no money to pay for these items. And I didn't want there to be any type of, scene or anything like that. And so I tried talking to her. One of our parents tried calling her, and it wasn't working. And so I had tried reaching out to the non-emergency police number, just to let them know what was going on. And I think I called like 3 times, and I couldn't get in touch with anyone. So finally, the individual my sister said she was waiting on, that she knew, came out and was talking to her, and essentially my sister was trying to ask him about like exchanging things, but she had never purchased anything, but in her mind she thought she did. And he was very nice, but I could tell he was confused. And so I was walking behind them, and so when my sister saw that I was walking behind them, just trying to listen because I wanted to be able to step in case things went south, I said, I'm her sister. And then my sister saw me and she started getting agitated. So I just calmly explained that I just wanted to make sure she was okay. So eventually he walked off. I introduced myself. I said, I'm her sister. I said, she has mental health diagnosis. She's in a mental health crisis right now. I said, I can show you proof that she has been in contact with the CIT mental health department, the crisis intervention team with the Denton Police Department. She was in services with Denton County MHMR. I can prove this all to you. I said, I'm here just because I want to try and avoid any potential, issues going on. So he was very kind. He was very understanding. He said that he had worked somewhere where he dealt with adults with similar issues. And so he said, well, let's go talk to his manager and let him know what's going on. So we went to talk to his manager, still kind of keeping an eye on my sister because at the time she was still in the store. And so while he and I are talking, we see her drop the basket off and walk out the store. And so I was relieved at that point, and I was explaining that I had taken a picture earlier of everything that was in the basket and a picture of my sister in case anything happened. I said, I can look through the basket. I said, if I find her, I'll look through her backpack because I had just taken her a backpack earlier that day for her to put her things in. And I said, if I find anything, I will reach out to y'all. I will come bring the items back or pay for them. I said, she is not, she's never stolen before or anything. She's just dealing with some untreated mental health issues, and she's just not in a good place. And so she ended up walking back in the store and went to go look for the basket again. So then I got concerned. And so the gentleman asked me if I felt I could go over there and talk to her and just explain that she doesn't have the money for things, or if I felt that would trigger her. I said, I think right now I'm a trigger for her. So he said, okay, he asked me, do you want me to get security? And I said, yes, please go ahead. And he was like, don't worry, I'll talk to her. You stay right here. So I stood there, called one of our parents back, updated them about what was going on, because at that point, I was really upset. The store was full. In my mind, I was just trying to keep this as inconspicuous as possible. I didn't know if my sister was going to get agitated and, something happen in the store, because in my mind, just being completely transparent, that's what I was afraid of. And so I'm standing and I'm watching them. I see him and the security go. And at this point, my sister's already in the line trying to check out. They go and they talk to her for a couple of minutes, and I see her walk out for the third time, and she didn't have anything. And so after a few minutes, he comes back up to me and he's letting me know that he just explained that she didn't have the money to pay for everything. They can't exchange things without a receipt. And he knew something was off because when she saw him that second time, she called him female. And he's biologically male. And so he knew something was off. And so I gave him my number. I gave him one of our parents' number and wrote my sister's name down and the number to the mental health unit, the CIT unit with the Denton Police Department, and just asked, if she comes back in, can you just please let them know what's going on with her? Because once again, I just have a fear and concern about, those who don't have an awareness or have the ability to tell when someone is going through a mental health crisis and forcive action being taken with her. And so I wrote all that down from him. And I was probably in the store for an hour and a half. And that day at work was just super stressful. So I was just overwhelmed, at this point, really holding back tears because just being in that situation was really hard, and just not having anyone else there, but in my mind, just trying my best to keep myself together and composed, think ahead of what to do, like watch her, and, just coming up with plans in case something, goes left. And so, the individual, he was a manager up front, and he was like, don't worry about it. And then he just stopped talking to me. He was like, can I pray for you? And I just kind of paused. And I was like, yes. I was like, I appreciate that. So he grabbed my hand. We're in the middle of Walmart, and he loudly just starts, not loudly, but, starts praying for me. And I really appreciated it because he could empathize. He shared with me he has another family member who is dealing with substance misuse, and just encouraging me and saying, it's hard when we know who they are but they don't. And it's been hard taking care of my sister and not having the support, the help, and the resources to get her the help that she's worthy of having and deserving of having. And just seeing how broken the system is, and the county that I live in does not have great mental health resources or supports, and seeing so many individuals and seeing so many families that don't have that help and support because they don't have the money, they don't have the knowledge. And even with me having the insight that I have from, being in my MSW program, but also from taking care of my husband, I learned to look up stuff. I learned to ask questions. I learned to advocate, staying on top of people, taking notes of when I talk to people, who I talk to people, knowing her, information and things like this, and not being afraid to, advocate. And I think about people who are not like that, and it can be frustrating. It can be lonely, and you want to do everything you can for your loved one, but it gets hard. And so after he prayed, he was just talking to me and encouraging me, and I just really appreciated that. And it made my heart hurt for my sister because I hate to see her going through this, and knowing that I'm just in a position right now to where I can't really do anything to help her. But what this made me think about, and one thing I've discovered about the way I want to practice social work, is businesses and organizations need more management like the gentleman that helped me that day. Because not only did he take, and he was very busy, like other people were coming up to him as he was simultaneously trying to help me and my sister, but he had an awareness of mental health, and he had the ability to listen, to show empathy, to connect with me in that moment, to comfort me, and to still treat. And in social work, one of our code of ethics is, I'm paraphrasing it right now because it's escaping me at the moment, but each individual is worthy of honor and dignity, and it doesn't matter, what they're going through. And he treated my sister like that. He didn't look down on her, or, at least if he thought that way internally, I didn't see it, and allow, stigma or misconceptions about people and mental health in how he approached and treated the situation. And so it made me think, like, more organizations need to have trainings dealing with the public, because at the end of the day, we really never know what people are going through, especially in customer service fields. So, like, organizations need to train frontline staff and management on de-escalation techniques. Organizations that work with people in general need to have, like, mental health first aid, mental health one-on-one something in dealing with people, even if it's not someone with a diagnosed or undiagnosed, mental health condition. They're showing symptoms, but like people have bad days. People, stress, get sad. And a lot of times when we're in grocery stores or we're dealing with people, it's things that we've been dealing with in the background and we've just kind of let it build up. So it's not, and we're taking it out on the person in front of us. But if these workers, and that's not an excuse to be like rude or disrespectful, but if organizations can provide these kinds of trainings to management and to their frontline staff, that example that day and what I went through showed me that not only can we be doing our part, is it a level of care in addressing our mental health, and I would even say, the intersection of suicide crisis that our nation, our country, our world is in, but we're helping like companies and organizations as well become, dare I say, trauma informed. We're educating them on mental health and how to just serve people in a better way, but also when they're at work and, coming across different people, we're helping them help themselves where they may come across situations like that. And so, I don't know. I just wanted to share that. And I was just really grateful to that gentleman, and shout out to you and how you saw me, you saw my sister, you had the desire. I'll also say cultural awareness is important because he's a Black man, I'm a Black woman, and understanding, especially in the area that I live in right now, with a lot of the racial tensions and things that are going on, not only in the DFW area, but in our nation, and having a genuine concern for my sister, and, coming across, either other people or like even the police, like that is a legitimate fear that I have, is getting a phone call. And so I appreciated that he was able to connect with me like that, and he honored and validated, and he was like, we got to look out for each other. And I was like, you're absolutely right, we do. And I just appreciated all the ways that he handled that situation. And it truly meant a lot to me being there, having to deal with that, by myself. And I was so grateful for him. I was grateful that, nothing escalated, but it just really showed me from a organizational systemic approach that more businesses would be better. They would be more proactive if they incorporated these types of trainings and things in their organization. Like I said, especially customer service jobs with individuals. So they're just in a better position to be able to help, people who are struggling, because you just never know. And so, like I said, with so many people who live in areas that are just underserved with, when it comes to mental health and things of that nature, that can be another level of access to care, another way that we can help give people tools to fight, against, not fight against, but better prepare ourselves to find ways that we can work to address the mental health and suicide crisis going on in our respective communities. So I just wanted to share that, and let me know your thoughts. I am a certified QPR trainer, which stands for Question, Persuade, Refer. It is a suicide intervention training. And so if that is something you or your organization is interested in, I would love to connect with you to provide that training. I also know other mental health professionals and clinicians that offer trainings as well. And so if your organization is interested in any of that, let me know, and I would love to be able to connect you to those people. But yeah, I just wanted to share that. And I really hope that we continue to make progress towards being able to provide individuals and family services when it comes to mental health and suicide, because it's hard out here and people are suffering, from the individuals who are going through it to their families and loved ones. And as a society, as a community, as a nation, we need to do better. So, bye.